Hi, everyone. My name is Elizabeth Miller-Walters. I'm the Assistant Director of Operations for the Advanced Practice Initiatives and Certification Outreach Team at the ANA Enterprise and American Nurses Credentialing Center. Welcome to our second webinar, focusing on advancing your practice with purpose, leadership at the system level. I'm going to go through the objectives and a couple things, and then I'll let our speakers introduce themselves. If I can make my slides go. So the continuing nursing education information: to receive one CNE, participants must attend the live webinar presentation in its entirety and complete a post-webinar evaluation. An email with the evaluation will be sent post-presentation, which must be completed no later than 1 month from today. You will then be provided with a certificate for your own records. The American Nurses Association is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. The ANA is approved by the California Board of Registered Nurses, and that is our provider number. So today we're going to talk about leadership, and we have two fabulous guests with us, Dr. Ashley Kellish and Dr. Paula Fessler, and they're going through some storytelling and interview type questions, hopefully meet these objectives for you. So we'll be discussing the current state of APRN leadership, define key components and processes for advancing APRN leadership skills and qualities, recognize leadership styles for APRNs, and identify information and access to tools to engage in improving APRN leadership skills. So I'm going to stop sharing so that you can see all of us. And hopefully you can see Dr. Fessler. I'll let you go ahead and introduce yourself first.
Sure. Good afternoon, everybody. My name is Paula Fessler. I have been part of nursing clinical practice for over 25 years. I will share a little bit more, but I never saw myself getting into a leadership role. I early on went back to school as a nurse practitioner because I loved being at the bedside. So we'll talk a little bit more about that later, but I've had CNO roles at UNC Chapel Hill, Westchester Medical Center, and also have been System Vice President for the Emergency Medicine Service Line at Northwell Health in New York. I truly love what I do. I love making a difference. And I'm very glad to spend today with you. So thank you so much for the invitation, Elizabeth.
Great. And I'm going to go ahead and let Dr. Kellish introduce herself.
Thank you so much. I too am also so pleased and honored to be here, getting to share our stories with all of you today. My current role is as both an associate professor at the UNC Chapel Hill School of Nursing, specifically in the DNP and MSN Healthcare Leadership and Administration programs. I'm a clinical nurse specialist by training and have had a variety of roles along couple of different hospitals here on the East Coast. But now one of my most favorite roles is actually serving in a dual role with that professorship and also as the director of our Center for Nursing Excellence on the medical center side. So definitely have had a colorful journey, and my role as a clinical nurse specialist has definitely guided me the entire time, and something that still really resonates with me and makes me proud of my journey thus far. So really looking forward to sharing more about that with all of you today.
That's a perfect segue, Dr. Kellish, into our first question. I want to hear about your nursing story and your journey. What drove you into nursing?
Sure. You want me to start, Paula,
Yeah.
And then we'll go back to you? I was thinking about this question. We did get a little heads up from Dr. Walters here about what she was going to talk to us about today. And it got me really reflecting back. And interestingly enough, when I was in high school, I actually went to vet camp. So I spent several weeks at a veterinary camp at Tufts University up in Massachusetts, where I'm from. And my parents probably spent a lot of money to send me to that very specialized camp where I was just inundated with animal care and had an absolutely fabulous time. And I will never forget my mother picking me up from that camp saying, well, how did you like it? You know, are you really excited? Is pursuing a veterinarian what you want to do? And I said, no, I want to be a nurse. And she was just baffled. And over the years, I've actually talked to several people who started their journey interested in veterinary school and then ended up going into nursing school. And what I found was when we were caring for animals, I was so drawn to the people that owned those animals and that I really wanted to spend my time caring for those people beyond that. So that's what got me to nursing school. I think what kept me in nursing school was just that ongoing commitment to the people that you get to care for. And I have kept that with me in all of my leadership roles over the years. I went to Boston College up in Massachusetts as well, and really just had such a great foundation in inner city hospitals, in working with underprivileged, underserved communities as well, in some of our clinical experiences that I had. And it just really set me up, without realizing it then, on a journey of trying to improve healthcare. And that's really where I sit today. But I started with a love of people, and I think I have kept that love this entire time. But that's really what got me into nursing. So Paula, I don't know if you have more to share on that side of things.
Sure. Thank you. Love the story. And I know you still love animals, so that hasn't left you. I would actually say I started my journey, and my journey was a little less direct, probably in every phase of my life. But early on in elementary school, actually, I had to do volunteer hours, and I spent them. I would ride my bike up the street to the nursing home. And the old folks home is what we called it in the neighborhood. And I would feed people. And my favorite part of that experience that I still remember incredibly well was listening to people's stories and just being present. And that's probably one of the most defining pieces of my career is I think the importance of being present. And I'll talk about that throughout today as well. Then when I got to high school, I was required to do hours. And those hours I did actually my senior year at a children's hospital. And I spent my time with a child life specialist. And I thought what they did was really incredible. And so I went to college, and I actually did biology. And it wasn't until my summer of my rising into my senior year, I did research that summer, and I thought that's how I'd make my impact in this world. And I was in a lab that wasn't allowed to speak. We couldn't talk. We listened to classical music all day long. And I remember calling my parents, and I said, I can't do this. This isn't what I want to do. So I graduated with every intent, knowing that I wanted to pivot and do nursing school. It was just easier if I finished one degree and then went back as a nurse for a second degree. So my journey from that very beginning wasn't straight, but still always knew what I think I wanted to do. When I got to the bedside, I loved it. I thought it was fantastic, and I couldn't wait to go back to school. So after I finished my second year out as a new grad, I actually started an NP program. And I'll never forget, I chose F&P. It was before there was even an acute care program out there. So I did F&P because I didn't want to have to pick between adult and peds, because I loved all ages, and everyone has a family regardless of their age. So that was where my journey started. And the most important thing for me is to make a difference. And I truly felt at the bedside, I made a difference with every single patient I took care of. And then as I inadvertently started to transition into some leadership roles, I still remember the first day that I started a job where I was no longer at the bedside. My husband said, aren't you going to miss it? And I said, I think so. Like, I was scared to walk away from the bedside, as I really, truly, I thought that was what kept me connected to the teams and kept me connected to the work that we were doing. And yet I will say, I still believe every leader needs to be present. You need to be connected, even if you're not hands-on. Doesn't matter your title. You should put scrubs on and go be with your teams. Get to know them, understand what the challenges are. You may think you know, but till you're out there with them, you don't really know. So it definitely was not a straight journey for me. And I think that actually has added to the journey and added to my experience and made me a better leader today. Thank you.
Thank you. Those are some really inspiring answers. Next part sort of segues really well with what you were talking about, Dr. Fessler, was what sparked you to invest in becoming an APRN? What was that impetus that you had for graduate education?
I knew right away I wanted to stay at the bedside. And to me, that was just a great way to continue adding to my skill set. I enjoyed my entry into nursing. I started off on a medicine floor. I learned a whole bunch. We actually opened up a step-down stroke unit on my floor when I was still very much of a new grad. And I had done my capstone for my senior year in the pediatric ICU. So at about a year, I switched back into the PICU and loved it. I spent almost 10 years in the PICU, and I transitioned actually from nurse to nurse practitioner. That was back in the late 90s, early 2000s, when the hours were cut and advanced practice started just exploding in the hospitals because fellows and residents couldn't work the crazy hours they were doing. So it opened up this whole new set of opportunities for nurse practitioners and some PAs, but it was really nurse practitioners back then, and it was fantastic. I would say, hindsight, as I've seen the progression of the last 20 years plus since then, I think the greatest thing that's happened for advanced practice providers, in particular in the hospital setting, is the start of fellowships or residencies for advanced practice providers. Back when I was trained, it was see one, do one. Now you're on your own. That's not probably the right thing for any of our advanced practice providers or our patients. So when I was up at Northwell, we started a system-wide fellowship program for advanced practice, and it has exploded. It's now in every service line and has really done, I think, great things. And I'd love to see that continue to help support our advanced practice providers transition into practice.
It's so funny, all the parallels that I hear from Dr. Fessler's story and my own. And when I'm thinking and reflecting on that question, I took my first job actually away from Boston. I grew up in Boston and I loved living there, but I knew at some point I just wanted to move away. And so I was wowed by the Georgetown University Hospital at the time, now MedStar, but I was wowed by their recruitment group when they took us to dinner at the top of a fancy restaurant in Boston and recruited us all as new graduate nurses down to Washington, D.C. So much to my family's chagrin, I did get up and move there. And in my first several years, I just, similar to Dr. Fessler here, just fell in love with bedside. But I also, on the other side of things, I loved patient care, but I felt like there were so many system problems in the way of doing it well. I remember a particular time where I was actually had spent the afternoon babysitting. I was on nights that week, but was off that particular night. And I got a call from one of our educators on the unit asking me to come in and staff that night an extra shift. And it was because a particular patient's mom asked me to come in. The patient was going to pass away. It was an infant. I also worked in the PICU, another parallel to Paula's story as well. And she said, there's no one else here that can come in and care for this patient and do all the end of life things. The mother has asked for you. The mother had to head back to Pennsylvania and cannot arrive until the morning. Can you please come in and do it? And of course I did, but even at that moment, and in looking back, I saw the holes in our system that made it so that this person who was not scheduled to work, had to go out of my way to go in and do it because for whatever reason, I was the only person at that time that could do it. And all of those examples that kept building up on this unit really made me realize that I needed to go back to graduate school and I needed to help nurses love the profession as much as I did. And that has always been my mantra in my background. And I really did look at both the nurse practitioner route and the clinical nurse specialist route. And one of the defining moments for me, because a lot of our classes in my program were actually shared as APRN classes, but one of the defining moments where I knew I was in the right spot for myself as an APRN was when our nurse practitioner group went to the sim lab and they were asked to learn how to insert central lines. And I, with my CNS colleagues, actually went to learn how to prevent infections on those central lines. And coming back together and exploring the how one thing leads to another and how their insertion and our prevention really go hand in hand. In this moment of synergy, which is really the synergy model is promoted with all APRNs, but really came to light for me as a CNS. That was when I knew I had chosen the right forward momentum as an APRN. And so I also during that time got an extra certificate in education as well, because I found that the reason why I was probably that nurse they called in that night was because I spent that extra time with my patients. I got to know them. I used my relational leadership skills that I didn't even have a name for at the time to really build a relationship with them. And I felt like I could do that same thing if I could educate others to do that. And that's really where my journey has taken me as a CNS, has been really to develop teams that all try to provide that same level of care back to that patient. So it wouldn't be that you have to call someone in on an off shift. It's that your whole team would be dedicated to that patient and family and be able to do that. And I spent several years actually in a PICU here at UNC in North Carolina as well. Then I had the privilege of getting to manage them, and I really saw a lot of that come to light. So even though my role as a CNS has ebbed and flowed in and out of that particular role, I think what I learned around connecting things and synergizing and pulling teams together to do the right thing is really what I've been able to promote in all of my roles.
Excellent. So interesting. It's funny because all three of us are old PICU nurses.
Yes, it's really interesting.
Old-fashioned PICU nurses. So tagging along with that, what are some of the key components and processes for advancing your APRN leadership skills and qualities?
So I was
Ashley,
thinking,
you want to go first?
yeah, I was thinking a lot about this, and I think the easy way for me to answer this is really not to say no. So I have found in everything that I have done, and I have worked as a simulation educator for Boston Children's Hospital, where I got to work with a world-renowned team and literally do some of the top simulation that I have ever been able to do, and have resources that I dream about now being facilitated here at a different type of university setting. But I think I never turn anything down. And I think that gaining that master's degree at that CNS certification, all of that as a background gave me the confidence to know that whenever someone came my way, I could say yes and figure it out. And that's where doors have just opened for me as an APRN. So I'm doing something now in this role. I never, ever thought that I would be a professor at a university. I never thought that I'd be leading an entire department of quality leaders, educators, researchers, and scholars all over a giant healthcare system, really, or large hospital, and impacting the care that we provide. I never thought I'd be here, but I've never said no. And so I think sometimes we're put into buckets with our degrees, right? And nursing loves degrees, and we love titles, and we love piling them on after our names, alphabet soup, if you will. But I think if we're not careful, we can get really siloed in those. And instead, I think really expanding opportunities. The other way that I've always expanded is interprofessionally. So some of my best colleagues are not nurses. Some of my biggest advocates are not nurses. And I found, especially after graduate school and moving into that system approach to healthcare in these hospitals that I've worked in, that the more teams that you can build that are filled with nurses and other professions, the better that we do with patient care. And so I think that my advice to anybody that's considering the APRN journey, or that is a nurse practitioner now and thinking, well, maybe there's nothing else for me, maybe this is all I can do. I think the skills that you gain as an advanced practice nurse set you up to be just absolutely amazing leaders. I'm looking at Dr. Walters right now and what she's doing. And I know that from her, she has also moved all around into these different roles, but she's able to do that because she has confidence and she has skills. We're able to think about things differently. If any of you are pursuing the DNP, you learn how to assess a culture, assess a problem, and then apply quality improvement methodology in order to fix that problem. Translate evidence into practice in a really systematic way. So I just see the opportunity as an APRN brings more than just a box that you have to fit in. What I do a lot with the teams that I work in is I find out what their job is and sort of what they're good at there. And then I find out what their passion is. And if we can align them with webinars like this, or consultation with other organizations, or sharing their expertise, all of a sudden they start to see that healthcare is a big but also really tiny space to work in. And you can be so helpful to so many if you put yourself out there. And that's really where I think I found my most success. I also consult for the ANA. And in doing that, I meet people from all around the world and really try to connect them to the evidence and to work that's out there. And that's because I learned how to critically appraise evidence as a master's prepared APRN nurse. I learned how to make sense of it. And then I've been able to practice that over the years. So I think my key theme here is never turning down an opportunity, but instead seeing it as a way that you can grow and push yourself in a variety of ways.
Dr. Fessler, what are some of those key components and processes you have learned for advancing your leadership skills and qualities?
So I loved Ashley's never say no. I'm going to go further back and say, and I never thought I'd be a nurse leader. I never worked for one that I really liked. I actually was in a state meeting the other day and saw my first CNO from almost 30 years ago. And I'm like, oh, you're the reason I didn't want to be a leader. I didn't know who she was. Once a month, and this is before email, guys. So, we had a mailbox in our break room, and once a month I would get a flyer in my mailbox with her picture on it. And that was the only way I knew who she was or what she was supposed to be doing. She was not present. She never came to the unit. It really was an insignificant role to me, even though I was a nurse in a very large hospital. So just really interesting. So that was never on my radar. I was the nurse and then nurse practitioner that showed up to things. So I have always been driven to make a difference. And I was actually in a great conversation with a colleague not too long ago that there are people in this world that are maintainers, and there are people in this world that are change makers. They want to make a difference. That's me. I've always been wired that way. It doesn't matter whether it's, participating and volunteering at school for my kids, or if it's at work, that's my nature. So, or even taking care of my yard. That's kind of how I'm wired. And so I got asked to go in and start my first leadership role. And I kind of remember I went home and I told my husband, I'm like, oh my God, Mike wants me to apply for this. Because I've never thought about it ever. And it was to be actually a director of advanced practice in the emergency department in upstate New York. It wasn't on my radar. I never even thought about it, but I was the nurse practitioner that went to all the meetings. I was trained in lean process improvement. I loved seeing how we could make things better, not only for our patients, but when you make things better for the patients, they're much better for the whole team. So it just kind of came full circle. So I would fully be transparent and tell you I got into leadership almost by accident. It wasn't the plan. And then things just kind of continued to go from there. A colleague that I had worked with in upstate New York had moved down to Northwell. She called me as I was finishing a master's in business, and she said, you're going to hate me, but someone's going to call you about a job that you're perfect for. So I'll tag into Ashley's. I didn't say no. I had no idea what I was getting myself into. I actually went all the way through those interviews. I went down 2 times for 2 rounds of interviews. And when they called and offered me the position, I never even knew what the position was. I had never seen a job description. I had only heard what the job was. And it's funny because that was my first executive level job. I'm not sure I would have applied had I known, because I wasn't sure I was ready for an executive job, but I interviewed for it and they offered it to me. And I was like, oh my gosh, well, here we go. And it was truly, truly amazing. And so a couple things from that I share with people is don't ever let the job or job responsibilities hang you up, in particular the title, right? It's the work and it's your passion that really help direct you to be able to get there. So, don't think about it. If you're just looking for a job for the title or for the administrative time, that might not be the right reason for you to go get a different job. But if you really want to make a difference and you have that passion, the rest of it, I truly do think it falls in line. Also along the lines of what Ashley had shared is really, truly, how do we connect with our interdisciplinary teams? That first executive job I had is from a physician that put my name in for it. So it truly, and she, we still meet quarterly for a Zoom, usually during the evening with a glass of wine and catch up and just see how life is. We haven't worked together in over 14 years, but it just, don't burn bridges, build those relationships, and you just never know what's going to happen or how those threads come back together. And I do think advanced practice is a really small world. So if you haven't been participating in conferences or networking, start now, because those are also some really great opportunities just to even learn what's out there and help connect your teams to other teams and share those ideas. It's nothing less than invigorating to know what other people are doing and to know that you're not out there alone, and you can really share some great ideas and make some wonderful improvements for your patients and your teammates. So Ashley was don't say no, and I'm just going to say, just be open to opportunities, whatever they may be.
Such great advice. I'm gonna address the comments at the end of the Q&A so that I'm making sure that we're able to meet the objectives for today's presentation. So I love all the comments going on in the chat, and I'm monitoring them, and we're not ignoring you. We're gonna read those out towards the end. I'd love to know what you all consider to be your leadership style, sort of what works, what doesn't work, what types of leaders have you worked with in the past, and what has been successful and not successful.
I'm chuckling a little bit because we have the same, Paula and I have very similar leadership styles, I would say, in a lot of ways. And interestingly, our teams have done some work in the HBDI space very recently. And if you could not tell, thus far, I am very yellow. And then yellow means that you are very innovative and big vision thinker and people oriented. And then when I'm stressed, I actually go to the green, which is like getting it done. So I always reconcile that to when I walk in my house and I have 4 children and I'm like, nobody talk to me, I need to clean. It just helps me like de-stress when I go organize the house. So that's kind of my my on paper side, but I truly believe that I am a relational leader and a servant leader. And those words I think we're all pretty familiar with, but what that means is that I have true compassion and empathy for anybody that I'm working with. And this is why I'm able to naturally build relationships. I also ascribe to something called the basic assumption. You can look it up. It's actually under the Center for Medical Simulation at Harvard. It's a phrase that is used and it is trademarked, but you can put your own organization or your team in there. And it basically says, I believe that everyone participating in whatever it is that I'm doing is intelligent, well-trained, cares about doing their best, and wants to improve. And that for me has been something that I can always fall back on whenever I'm faced with a difficult leader, or maybe someone that has the exact opposite personality than me or the exact opposite approach. I can always fall back on that basic assumption and say, I believe that their intent is good here, and I'm going to find a way to work with them or to come to a place where we can work together on whatever it is. But I think the key to all of that is truly being vulnerable, being authentic, being open to feedback, and not only open to it, but accepting it, filtering it, and then responding in such a way that either improves you or perhaps provides, further reasons why something happened the way it did. But over the years, I have really grown in my ability to be just honest and transparent with those on my teams, those that I am working with. And I have found that the more you can do that, the better all of the outcomes are. I think a short example of that I like to share is when I was managing our PICU, and I was asked by the nursing staff to basically escort a family that had taken over our waiting room out because they were taking up a lot of space. And it was becoming bothersome to other families that were coming in. And I believe I used my APRN approach to this and my advanced training, because when I walked in there and assessed the situation and I found that the family was a broken family, if you will, the child that they were waiting for was going to pass away in the next several days. The parents were divorced. They were young. They both had advocates for each other and their side, and not one of them was going to be left in a hotel room while that child died. They were all going to be there the moment it happened. And so I worked with that family. We actually found another space for them to also utilize with some of their stuff that they had. I also found out at the time that one of our services that they should have been able to use had turned them away, which was on us. So I was able to rectify that for their extended family members. But the long story coming short is that at the end of it all, the family wrote such a beautiful letter about how hard it was to wait in that waiting room and how really poor the waiting room was, and how they watched family after family come in there for much shorter times than them and just be uncomfortable. I rose that letter up through leadership, and it was able to help us find monies from a donor to actually improve the waiting room at the end of the day. So I know that's kind of an altruistic example, but I really believe everyone here has something to offer in our life. And life is so short, so we've got to go figure it out every chance we can and apply that style of leadership to the teams we're working with. We can get real caught in our egos. And I will also add, I never have to be right. In fact, most of the time, and according to research, we're all 50% of the time we're wrong. So that to me is very comforting to know that I don't have to be right, because probably I'm wrong. And together we can come up with the right solution. So those are some of my key components to just really loving everyone truly, and providing psychologically safe spaces for everyone to practice whatever it is that they're doing, and welcome them with open arms, and find good intent and go from there.
That's awesome. Thank you very, very much. Our leadership styles are very similar. I am also yellow and strategic. And then when I get stressed, I'm actually pretty balanced between going to analytics and process and planning, and then also the people. I really do care what happens to the people. So those three are pretty well balanced, with the strongest being yellow and strategic. As far as my leadership style, I actually say I'm a transformational leader, and I think there's three really key components. And it's not only for me, but I actually think it's for every nurse and everyone at the bedside, because we're all leaders, even if we don't have a formal title. We're leading our patient and their family. That's a team. And there's more teams today than ever before. When I started at the bedside, we didn't have NAs. We were a team of one. We were truly a primary care nurse, and everything was on us. And today we have much more dynamic teams, and our nurses are leading those. Our advanced practice nurses are definitely leading teams. So the three things that I think are really key, and Ashley connected on these already, but being relational. I don't think if you're not present, you're not going to know your team. They're not going to know you. You have to have a relationship, whether it's with the team or your patients or their family. We all know we're going to have a hard day. And that hard day and that hard conversation is so much easier to have if you have a relationship. But if you don't have that relationship, it's really tough sometimes to walk away and know that you can still move forward in that relationship before somebody puts up a barrier and a wall. So I truly, truly stress relationship is key, making sure that you're aligned. And, if you find that your values don't align with those of your organization, maybe it's something you think about changing. If you can't change them, it doesn't work well to not be aligned. My second one for the transformational leader is another phrase that Dr. Kellis used, was to be authentic and caring. I think sometimes that sounds really simple because we're in nursing, we should care. But I've worked with people that I wonder if they still care. Are they just there to check the box? Or are they actually there because they care and thinking about things? And sometimes it's the soft stuff that people remember the most, right? Did you offer someone an extra blanket? Did you bring them a toothbrush if they came in through the ED? And granted, that might not be advanced practice, but just making sure that those extra things are taken care of by our team are really, really important to the patient and the family member. And then the last piece is really being transparent and honest. In a perfect world, we would do everything on a budget that was unlimited. That is not where we are today. It's probably less unlimited and more limited today with COVID, as we're still trying to find our way. So, being really honest and say, here's the 10 things we really want to do. Here's some of the pathways that we can do it in, and then have the team from a shared governance perspective really weigh in on what that looks like and what some options are and what's the highest priority to the whole team, I think has been really, really helpful. From a leader perspective, I truly think our front line has all the answers. People at the bedside know what they need. And that circles back to why I think leaders need to be present in the care environment, because if you're not present, you're not going to hear people's great ideas. You're not going to see what their barriers are. They may not even be able to express them because they're just so used to doing them. In addition, I'd say the other two things that are super important as we move forward is continued talent development and innovation. Because if we stay where we are today, I think it's going to be a real challenge. We still need to go, I think, significantly further than where we've come, and COVID challenged us. I actually truly believe nursing is going to be so much stronger on the other side of this, but we're still getting to the other side. So how do we be innovative in our care models? How do we be innovative in just our approach to care in ways that maybe we haven't had to be in the past, that we're still in a slightly uncomfortable phase while we're working through that. But I think all of those pieces are really important, and I'm excited to see where we're going. I think this journey is pretty amazing.
And I just want to pick up on that piece as well, too, because I think if you put it all together, you really can't innovate and change if you don't have teams that feel valued, that feel like their input matters, that feel like what they say is going to make a difference. Obviously, knowing that we have our constraints and our limits, but if they're a part of that decision-making process, whatever level that we're talking about, all the way to the COO, C-suite of an organization, that is where I think the true innovation is going to come from. And to your point, we are so held back sometimes by barriers or old ways of doing things because we haven't built the relationships with those doing the work to really allow them to innovate. And I think when you can see some amazing things. That's when you empower your teams, you can really see change across the board.
Absolutely. So now we're going to switch gears a little bit, and I want to hear about one challenge that you have faced in your APRN journey and how did you deal with that challenge? There's actually a lot of people mentioning some challenges they're facing in the chat, like finding jobs and things like that.
So I actually was sneak peeking and I saw a question, I think from a fellow CNS, it might be from an NP as well, but talking about the certification hours in our roles when we're not directly practicing. And so that was a challenge for me. I'm in my next bucket of certified window of time. So I've got a little bit of time here to work through it. But I will say that that was really hard when I was in working before I became a manager. I was what was called a clinical nurse education specialist, because to be honest, on the East Coast, we are often limited in hiring clinical nurse specialists, a lot up in the Northeast and a lot in the Midwest, but where we are here in the Southeast, I found a challenge with that particular role. And so I really worked hard at that time to convince my leadership exactly what Paula was referencing about being present. And it was a little bit selfish. It was to help with my hours as well, but also because I never have wanted to be disconnected from the work that I was trying to make better. And so I built at the time what I called immersion shifts. And that's how I won over my nursing practice and professional development, or ANPD, leader who felt like educators should be in the classroom. And we had a little different philosophy about where we see ourselves being the most successful. And so I developed an objective where I was going to spend X amount of hours, and I really did it over a 2-year period of how many hours that would give me at the end towards my CCNS certification. And I spent those hours in scrubs helping to care for patients, which is really a lot of times the role of the CNS is dedicated to one unit and you are out there all the time with them. So I had to recreate that version that would work with me and my leadership, but I uncovered so much during those hours of time and I became one with our teams. But the trust that I built was tremendous. I could see policies and when they were working and when they were breaking right there in front of me, and be able to go and address them. I could help with new patient care populations that were coming through. So it was really an amazing work, and something I'll probably have to replicate as I go for the next time that I want to re-up my CNS, because I do believe that being as close to patient care as possible is what makes us the best. And so those of you struggling with that, I would probably work with your leadership to negotiate some time. If your position has moved you away from practice, see if there is a way that you can maintain your practice in maybe, half a day a week or a day a week. I work with a lot of faculty that still practice 1 day a week. And that's protected time that they have in order to maintain their license and their certification, as well as their skills in what they do. So I would suggest working with your teams. That's definitely been the hardest thing for me, because a CNS just doesn't really fit. There's not one way to do it. And so I've had to be creative to make that happen, but I never want to lose that certification. It's what I am most proud of in everything that I've earned thus far.
That's fantastic. Completely agree. And I think having that connection back at the bedside is really important. As far as challenges, I actually, just reflecting back on the past 25 years, the greatest challenge was being a leader through COVID. I hope that never happens again in our lifetime, although I'm incredibly proud of what we were able to do. I don't even know if I need to say more than that on that one. I will say I actually think our next greatest challenge that we've all, or most of us, have probably experienced is the transition from paper to e-record. And I say it's a challenge, it's the greatest thing ever because you can actually read a chart, but I don't think our charts tell stories anymore. And stories is a lot of healthcare, right? You could read through day to day and you could understand the progression of how a patient went, whether it was from physical therapy or speech therapy or the physician note or the nursing note. Like in about 10 seconds, you could really understand where a patient was. Today, you have to hunt and peck through multiple different places, and people may put a teeny tiny note in a spreadsheet somewhere or a flow sheet somewhere that someone else is never even going to see. And so while you can read it, I also think it's really denigrated our ability to know this patient's story, number one. And I also think it has really been horrific on our relationships with our provider teams. We have providers that sit in a different building, and when the nurse calls to say there's this going on, they'll type in an order and they never go to the floor to see the patient anymore. In the old days, when I started working, they went to the floor because they had to come write their order.
Mm-hmm.
So that is a piece that if there's one thing I could change moving forward, it's how do we reinvigorate that? And I have 3 children, and they're all of the generation that would rather text than call you. And, we talk about the real importance of being able to have that conversation. And if something's going back and forth 3 times in a text or an email and it's not clear, please pick up the phone. Please have that conversation, because your patient deserves that clarity. Your team deserves that clarity if there's some unknown. No one goes into healthcare to hurt somebody, but the greatest reason that patients have unintended outcomes and bad things might happen is because we don't have clarity of communication. So I do think that's on all of us as we move forward in this new world, new generations and new ways of documenting. How do we make sure that we preserve that communication that I do think was really significantly stronger? And the other piece I just want to tap on, and it came up in the chat actually a little bit, I think it was Wendy talking about leadership in CNS. When I was in one of my roles, we did a system-wide assessment of nursing leadership talent. And my very favorite was the number of nurse managers came back and said, oh, someone's in NP school, or they're studying to be a CNS. They don't want to be a leader. And I think that's so wrong. And I do think that that's a premise out there that a lot of people have, that you just want to be at the bedside. And that's what I thought. But I think if anything, it just opens up more doors. So I would say collectively, the assumption that if you're in school to become an advanced practice provider, my experience is the assumption is that means you don't want to lead. And I think that is something that is, I think as an advanced practice provider, we have such a wonderful background to lead. You know what it's like to be in a provider role. You know what it's like to be a nurse. You understand scope of practice better than anyone else out there because you've been in both. So I highly advocate, if you're interested in leadership as an advanced practice provider, start showing up to your meetings, participate in shared governance, help with process improvement, and, just get your feet wet and see what those opportunities are, because I think they're truly amazing.
Mm-hmm.
All right, and our last question before we get to questions from the audience, what are some of the tools that you have used to engage or improve your leadership skills?
I was thinking about this as well too, and I wanted to be very clear and specific for all of you. So it's a little bit funny, but the first one is Coursera. Coursera is a wonderful free website that you can access from anywhere. And if you want to get further education about something, a lot of universities and colleges have dumped programs into it. You can pay to get certified after attending some of the courses. But I guess that's my theme around just constantly improving myself. And that's a way that you can do it for free, or you can also pay to get, a further certification as well too. I read a ton. I have about 4 or 5 books on my bedside table that I am constantly going through, even if I don't think I like the book or I want to read the book. If it's a topic I think I already know a lot about, I still am a prolific reader. And I think that really helps to keep me up to date with different ways of thinking about things. And I'm also a huge reflector. So whether it be the time that I am driving from here to pick up children or the time after they've gone to bed, I do spend a lot of time reflecting, and not with grief or with anguish or with regret. I actually just reflect and think how things went and how things could go differently if I did it again. And so those are 3 things I would say: finding free ways to improve yourself, and then reading, and then constant reflection, and also finding your, I'll add one more, someone mentioned this once, a leader mentioned this once, their cabinet, basically like their group of safe people that they have to bounce things off of, to validate thoughts or ideas, and then to go through those reflections. And they can't be people that are just going to yes you to death. They have to be people that challenge you to think differently or to think about something in another way. And I think I have a few of those people in my pocket that really help me grow no matter what situation I've been a part of.
That's fantastic. I will add, and certainly I think reading is a great thing. It gives you a different perspective than maybe the one that you brought with you at the beginning of the book. Love the whole cabinet idea. And I actually have to say, when I got through the worst part of COVID, a friend of mine had reached out about participating in a nurse executive fellowship. It was actually October of 2020, and I was up in New York for the first round. So our first round was pretty significant. And I remember telling her she was crazy. There was no way I had time to do a nurse executive fellowship in October of 2020 after what I had just been through. I hadn't seen my family, it felt like, in months. And things were just starting to quiet down, and we were rolling out a new e-record. Like, it just was not going to be the thing. And then she called me again over the winter holidays, and she's like, the deadline's in a week. Are you going to do this or not? And I reflected, great word, Ashley. I reflected that after everything we'd been through for COVID, I realized my network of nurse leaders was smaller than it should be. I had a few people I could call, but I didn't have a strong network. I didn't have that cabinet that Ashley just spoke about. So I actually did a nurse executive fellowship from 21 to 22. It was amazing. About 3/4 of the nurses in the nurse executive fellowship were in similar roles to mine, leading hospitals or in very strategic roles in their hospitals. And about 25% were in schools. And in my mind, I've never been very academic outside of getting my degrees. So that wasn't a whole pathway that I knew much about. And it was amazing, the collaboration between the two groups, what we could talk about as far as models of care and just different ways of approaching problems. And it's our academics who are helping train our new nurses that we need in the hospital. So I think it's really important that we actually are connected and not disconnected. So I'll definitely put the plug in for reading. I'll put a plug into, if you don't have a strong network, look at fellowship programs, participate in conferences. And then also the last thing I'll say is tap really diverse teammates. And diversity for me is everything. So it could be, skin color, ethnic background, where they grew up, right? Because lots of people bring different things to the table and how they communicate or just how they think because of even geography, where they were raised. So all of those things, I think, make us better leaders. If we only have a team that consists of people who look like us, sound like us, and have the same idea as us, you're not going to have a very strategic plan moving forward, because you're not going to probably have someone that taps you on the shoulder and says, hey, I think we need to think about this differently. So I think it's truly been a fabulous journey. And I'll quote Robert Frost, "The road less traveled." I think those are some of the most fun ones to navigate. So open your eyes and just be open to new experiences. Thank you.
Thank you both so much.